Welcome to Healthcare India. We do see a lot of patients of all age group with knee pain, but the cause can be different in different age group. Usually when a patient comes to us with a knee pain, we try to figure out what it can be, the cause. The most common cause for knee pain is either osteoarthritis, inflammatory arthritis, or the issues with the kneecap or patella. These are the main three reasons we try to find out, and all these three things can be present in different age group, not in all age group. Like the younger age group, that means those are below 30 like that. In this age group, if the knee pain is there, then we think about two things. One is inflammatory arthritis, that means rheumatoid arthritis, or chondromalacia patelli, where the cartilage of the kneecap become thin or soft, and due to movement they create pain. And we try to figure out what it can be. So if the patients have different other joints pain also along with the knee pain, morning stiffness, and they give the history of swelling and stiffness of the finger joints, then we try to figure out and find out the other possible things and diagnostic criteria and inflammatory markers in blood investigations to establish that does that patient have inflammatory arthritis, rheumatoid arthritis or not. If all other things are not there, only knee pain is there, and that knee pain is front of the knee, and patient has difficulty in stair climbing or getting up and sitting down, then it is probably chondromalacia patelli, not any other things. Then we do only few x-rays, not any blood test, and try to find out is there any treatable cause for that kneecap pain or not. Patients of the older age, like those who are not very older age, above middle age, that is more than 50 or 60, the first cause that comes to our mind is osteoarthritis, that means degenerative arthritis. Here the cartilage get thinned out or eroded due to repeated use of the joint, not due to any inflammation and other thing like rheumatoid arthritis. Rheumatoid arthritis can happen in this group, in older age group, but they are not so common. The most common is osteoarthritis. So usually we do not do any blood test in this group, only do the x-ray and try to figure out how the bad knee is and what is the condition of the knee due to the arthritis. But the patients in between these two ages, they are a bit tricky. So here the chances of osteoarthritis is not so high, and also chances of inflammatory arthritis is also not high. So when the patient comes with a knee pain between the age of 30 to 50, sometimes it becomes difficult to get the diagnosis. But still we have different method, clinical examination, their clinical presentation and blood test and x-ray. Ultimately we can get the diagnosis from these patients, what kind of arthritis they are suffering from. So in a nutshell, younger age group, the most common cause of knee pain is rheumatoid arthritis or chondromalacia patelli. Older age group, the most common cause for knee pain is osteoarthritis, that means degenerative arthritis, and sometimes rheumatoid arthritis. In middle age, between 30 to 50, both can be, but usually it is the sequelae of chondromalacia patelli that is converting to arthritis. We care about it.